Can bleeding during a natural miscarriage have an impact on future pregnancies?
Hello and welcome. Today, we are going to discuss a sensitive yet highly important topic, miscarriages and their potential impacts on future pregnancies. More specifically, we will be exploring if bleeding during a natural miscarriage can have any influence on subsequent pregnancies. This is a concern for many women who have unfortunately experienced this loss, so let's dive in to provide some clarity.
What happens during a miscarriage?
A miscarriage is the loss of a pregnancy during the first 23 weeks, and it's a common occurrence affecting approximately 15 to 20% of recognized pregnancies. During a natural miscarriage, it's typical for a woman to experience bleeding. This bleeding can vary from light spotting to heavier flows similar to a heavy menstrual period. Other symptoms can include cramping, pain in the abdomen, and loss of pregnancy symptoms. The bleeding and cramping help your body to naturally expel the pregnancy tissue.
Does bleeding during a miscarriage impact future pregnancies?
The short answer is that bleeding per se during a miscarriage doesn't directly impact future pregnancies. The bleeding is a symptom of the miscarriage, not a cause of future fertility issues. However, complications arising from a miscarriage can potentially affect future pregnancies. These complications could be infections or uterine scarring, which might occur if the miscarriage wasn't complete and tissue remained in the uterus, leading to a condition called Asherman's syndrome. But remember, these complications are not a direct result of the bleeding but are associated with the overall miscarriage process.
How to ensure a healthy pregnancy after a miscarriage?
Having a miscarriage can be a distressing experience, but it's important to note that most women who experience a miscarriage go on to have healthy pregnancies in the future. Some ways to increase the chances of a healthy pregnancy include regular prenatal checkups, maintaining a healthy diet, staying physically active, avoiding alcohol and tobacco, and managing stress levels. It's also critical to allow yourself time to heal both physically and emotionally after a miscarriage before trying to conceive again. In conclusion, while the experience of a miscarriage can be distressing and fraught with worry about future pregnancies, the act of bleeding during the miscarriage does not itself affect your future pregnancies. Your body is designed to heal, and a previous miscarriage does not necessarily mean you will face problems in your future pregnancies. Always consult with your healthcare provider about your concerns and remember, it's perfectly okay to seek emotional support during such times. We hope this video has helped provide some clarity on this topic, and we wish you all the best on your pregnancy journey.